We turn now to the general surgeons at Dunedin Hospital and how much surgery they're actually doing. In our investigations of the past fortnight, we've repeatedly been told that urology, cardiothoracic and general surgery have had their theatre hours restricted by a shortage of ICU beds for post-operative care. This can even mean patients being prepped for surgery, ready to go into theatre and then getting bumped. In some cases, as we've heard, more than once. But last week we were told the pressure on theatre time and post-operative care is so great that general surgeons get 1 day a fortnight in theatre. 1 day a fortnight. We raised this with the Minister when we spoke to him on Friday night.
I struggle to believe that a full-time general surgeon is only doing 2 lists per month. They'd be doing 2 lists per week. Are you sure you're reading that?
2 lists per month. Operating twice a month.
Well, we need to look into that because that just doesn't sound plausible.
Jonathan Coleman, who, as you heard, said he'd look into that figure, and we did too. It's correct. As confirmed by Dr. Joe Kreiser, the clinical leader of general surgery at Dunedin Hospital.
Our surgeons have 2 operating lists a month, so it's a 1 operating list every 2 weeks.
1 operating list is 1 day, is it?
Yes.
So we raised this with the Minister on Friday night on Checkpoint and said general surgeons are getting 2 days a month, and he said that is just not conceivable, but it is fact, is it?
It is indeed a fact.
2 days a month?
Yes, which is frustrating, and it's a frustration we have been trying to move forward on for a number of years, but we're still in a situation where there isn't adequate theatre resource provided to our surgeons to be able to do the work they're expected to do.
And that the ministry requires them to do too, right?
Indeed. So we are provided with targets which we need to meet as a service, but we have not been able to do that.
Through no fault of your own? In other words, is some of this simply down to lack of ICU beds, lack of theatre time, competition with other departments for theatre time? Are you being excluded from theatre when you are available to operate and want to operate?
Very much so. We as surgeons should have at least a list a week to be able to manage the volume that's coming through and meet the targets, but unfortunately, through lack of resource provided from the ICU and theatre capacity side of things, we have not been able to do that.
And if you can't get in to the theatre for reasons that seem on the face of it to be beyond your control, and if people are forced to wait longer, are there financial penalties applied by the ministry in some cases because of that?
There are, and that's where we struggle, because we're being financially penalised for things which are out of our control, and we've been unable to resolve.
So you're talking about a resources issue. As a result of a lack of resources, a shortage of resources, you're not able to operate as much as you would like, as much as the ministry requires you to operate, and the net result of that is the ministry financially penalises you.
That's right.
Would you like to operate more often?
Very much so. There are patients who need to have those operations to improve their quality of life, and at the moment we're struggling to provide good patient care because of lack of access to elective theatre.
Are you available to operate more often? In other words, if you could get more time in theatre, would you be able to do the operations?
Yes. I mean, there are people waiting for months and years for certain procedures, which unfortunately we cannot provide.
Are you frustrated by this?
Very much so. It has been a frustration which we've shared, and we've tried to move forward, but currently I struggle to see a way forward without extra resource provided to ICU and theatre access.
Right. Can we compare Southern with other DHBs? If you were in Canterbury or Auckland, for example, would you be getting a day a week?
Yes.
Right, you would.
Yes.
So
there is no other DHB, I don't think, in the country where a general surgeon would not have access at least once a week to elective operating.
That's Dr. Joe Kreis, the clinical leader of general surgery at Dunedin Hospital. Now, in the past fortnight, we've spoken to the DHB CEO, its Chief Medical Officer and its government-appointed Commissioner, all who've made themselves available. As you've heard, of course, on Friday night, we've also spoken to the Minister, but we haven't spoken to the Ministry, and we'd really like to. We're interested in two things: financial penalties being applied on DHBs when delays to surgery are beyond their control. Now, in a written statement to us, the Ministry says it has not imposed financial penalties on the Southern DHB. Surgeons have said that they certainly are a possibility, but they haven't been imposed, the Ministry tells us. We've just spoken to the DHB CEO. Our producer Bridget Burke's just got off the phone with him, Chris Fleming, who says whilst they haven't had penalties imposed, as a result of under-delivering on targets, they've been able to invoice the Ministry for $1 million less. So there is a financial cost. We want to discuss that with the Ministry. The second issue we'd like to look at is hospitals referring patients back to their GPs so they're not on waiting lists. We revealed this last night on Checkpoint, a kind of referral merry-go-round which avoids financial penalties for excessive waiting times. This is a widespread practice, we now believe. Outside of Dunedin too, the Ministry wouldn't join us to discuss that either. We also asked the Southern DHB if we could visit Dunedin Hospital and see their ICU facilities and where the new beds are going. That request too was declined. Meanwhile, last night on Checkpoint, we revealed two orthopaedic surgeons have written to the Minister to respond to some of the points he made on our program on Friday night. Well, that was followed up by Labour's health spokesperson David Clark during question time in Parliament this afternoon.
My question is to the Minister of Health. Does he agree with the authors of an open letter to him reported on Checkpoint yesterday that comments he made on Southern District Health Board suggesting one of our departments is, quote, toxic, and that the District Health Board is, quote, is a cot case, are particularly unhelpful? If so, will he now apologise for those comments?
Mr Speaker.
The Honourable Dr Jonathan Coleman.
Mr Speaker, the comments the member is referring to have been plucked from a 14-minute interview I did last Friday. As regards the first comment, that's how matters have been described to me. I also said in the interview that the reason we had to put a commissioner into Southern District Health Board was because it was a cot case. Turning around Southern DHB was never going to be fast or easy, but I'm pleased to say that thanks to the hard work of the commissioner, the new CE and the 4,500 staff, the DHB is on a long-term track to sustainability. The government is working on the indicative business case for Dunedin Hospital. The facility needs upgrading, and this government is determined to make that happen.
Put a Crown monitor in 2010. Supplementary.
A supplementary question, Dr David Clark.
Does he think it is acceptable that 1/3 of orthopaedic patients at Southern DHB are unable to be seen and are referred back to their GP because of a lack of capacity?
The Honourable Dr Jonathan Coleman.
Well, as with any assertion that member makes, we'd have to go and check that. He was wrong on the ICU beds, but the fact is, across the country, out of all those patients referred from general practitioners for first specialist assessments, 87% see a specialist, about 5% actually are turned away, another 8% just have been inappropriately referred or their time has passed. Thanks.
Health Minister and Health Spokesperson Jonathan Coleman responding to questions in Parliament from Labour's David Clark.